everybody. What's up? It's your girl Queenie, and tonight we are back with Dr. Lane Rowland. I'm so excited. I want to wait a few minutes to make sure everyone is in studio, everyone is here. Share this video, like it. We have some amazing and I mean, time sensitive information that we're going to be talking about tonight with Dr. Rowland, and we have another special guest tonight. So please share it, share it with your family members, share on your page. Just keep it going. We're going to be talking live. If you have any questions for Dr. Rowland or anyone else that's on the panel tonight, please send them in, drop them in our comment section. Many of you have my personal contact. You know you can always send me the message via my messenger or via text, and we will have those questions answered for you tonight. So without further ado, I want to quickly introduce Dr. Lane Rowland. Many of you know him. You've seen him here on the show, excuse me, or you've been following him around IG and all over Facebook because, you know, he's out there. He's doing his thing. But Dr. Rowling, you know, he's an infectious disease specialist and trauma surgeon, head of COVID-19 healthcare task force and USA chief medical officer for SRS products and so much more. Like the list just goes on and on and on. And so I want to definitely make sure that you're here tuning in and listen to things he's having to say about COVID, the vaccine trials, the holiday that's coming, and you know, how are we going to get together with our families? I mean, I know many of you are wondering that. I know I am. So, can we travel? What is it going to look like? You know, the second and third wave that's coming. I mean, or that's here. There's so many things going on. And so, without further ado, I want to bring in Dr. Lane Rowland once again to the Bar Talks platform. Dr. Rowland.
Hello. Good evening, Queenie Love, and hope you're doing super fantastic. And shout out to the world.
I am. So, how are you doing tonight?
Well, just busy. I just got back last night from Atlanta, and then I'm flying out in 4 hours back to Maryland, NIH. So, just being busy and stuff, and having a good time and trying to educate people. And this is my calling right now. And one step at a time, one day at a time, one life at a time. And so, right now, my gasoline is full in my car, and I'm ready to go.
I love it. You are, I mean, I love your energy. I love the fact that you love bringing the information to the people, spreading this information and helping so many of us remain safe and even, lowering our anxiety and keeping us informed, with the proper tools that we can, use so we can navigate this crazy time. So thank you so much for coming back once again.
No,
what are you drinking on tonight, Doc?
Well, we've done cognac, we've done wine. This is supposed to be eggnog. This is an eggnog. So I salute everybody out there on your platform, and everybody salute eggnog.
Get your eggnog if you look. Get your eggnog because Doc wants y'all to have eggnog.
Oh my God! It's this time of the year, eggnog. Yeah. It just brings back that good old home country boy from Louisiana type of taste. I love it.
Yeah. And it's the holidays, right? Like it's the holidays. In spite of this pandemic, it's the holidays, and eggnog and holidays just go hand in hand.
Oh, absolutely, and stuff. And like I say, it's just it's amazing the what I've said 6-7 months ago where we're at today, and this thing is just we're not even in the first quarter of the second wave.
Right. Wow, that is so scary when you say that. Like we're not and here it is. This is November. We have November, December, January, all the holidays to get through, flu season to get through. I mean, what are we gonna do, Dad?
Well, I think the most important thing is just having the best attitude that you can have and be positive and understand the information and make sure that you're getting the information from people that know what they're talking about. Let me give you guys 2 examples where I think one of the biggest problems that we have in the United States and worldwide. I'm in a Uber going from the Hilton Hotel to the clinic in Atlanta. So I asked the Uber driver, hey, what do you think about the COVID-19 and the SARS-CoV infection? Oh, he said it came from Iran. I was stunned.
Wow.
Then I had two little black boys on their little bikes that kind of remind me of when I was a kid in Louisiana in front of the clinic, and they didn't have any mask on. So I went up to them and says, "Hey guys, where your mask at?" And these two young boys said they don't believe in this. This is a hoax.
Goodness.
And I was stunned. And so now I kind of understand when we have such a disconnect from, the reality of what's really happening with the virus and what's happening on the ground with the people. And
Mhm.
this misinformation at the beginning is just throwing everybody into shambles. And so now the new philosophy that I believe I'm going to have to do is not about community spirit of the virus. We have to have community spirit of education. We're going to have to
Mhm.
reset the clock back, and we're going to have strong town hall meetings and folks talking about understanding the virus, where it's going, and all that stuff. Because, folks, we have a long ways to go. This is not a pandemic anymore. This is an endemic infection. The virus is going to be here for the next 50 years. The question is that how do we mitigate and contain it, and making sure that the effect on the society is going to be tremendously bad in 4 or 5 years if we don't intervene now with good policies and procedures.
Wow, Doc, that's really heavy, and I think you're right. A lot of people just they don't take it serious, um, and it's unfortunate because it's a gamble.
It
Whomever
is.
comes,
We tested.
contracts it, it's a gamble with their life, and I think definitely take it more serious.
Well, I get it. I understand it. We're going to be try to test everybody in America. So we're in Atlanta. We're starting to do our
Mm.
testing on individuals, and so we went to one of the movie sets, called us and said, "Hey, can you guys come and test some of our employees?" So we went and tested. We tested the actual EMT that's supposed to be responsible for the healthcare of the actors and actresses on set, and guess what? He ended up being positive, and he was
Wow.
upset because he couldn't work anymore. But this guy was probably contaminating, infecting other people, the actors and stuff. So that's why we have to get some type of control on this. And people need to understand that this is a serious disease. It's a serious virus, and the virus can change people's lives. And everybody's going to have different reactions to it. And you can get sick and you can die. And you don't want to get sick with this virus because the unknown of what's going to happen after you get exposed. We're talking about the rehabilitation, mental fog, shortness of breath. And I can go on the list and list and stuff of what to do, but you know what? Let me have a sip of my eggnog because we're supposed to be having some fun tonight.
Well, with that being said, I think it's a perfect time for me to allow in our most beautiful Dr. Patricia Jones Blessman. She is, of course, she's waiting in the waiting area before she gets into studio. But to all of you that may not know, Dr. Blessman is a clinical psychologist and author, and she's so many other amazing things as well. She's kind of being modest when I asked her to give me some information about what else she does, but I'll take that. But I do know that she's a sister about her business, and she takes this situation serious. She really is trying to get this information out and trying to help all of us cope with dealing with the stress and anxieties of this, as Doc said, endemic. So, Dr. Blessman, welcome.
Well, thank you, Queenie, for having me on the show. And good evening, Lane. It's nice to see you
What's up,
in the
Dr.
flesh.
Jones? And
Hey,
you got to talk about our
Ch-
book and eggnog.
Chicago is in the house, right? Well, first of all, I just want to, thank you, Queenie, for using this platform to educate and illuminate the community about this virus, and also using this opportunity to be able for folks to be able to learn what strategies and techniques they can use to actually not only survive this, but we need to thrive while we're living through this moment. And
Yeah.
I think what I appreciate about this collaboration with Dr. Lane Rowland is not only does he keep me in stitches, but because it is important to have a good laugh every day and to not be buried under the weight of this. We're going through this storm, but we're resilient people.
Yeah.
We have gone through much worse than this. Our ancestors have gone through quite a bit for us to get to this moment.
Yeah.
So we have it in our DNA and in our core to be able to survive
Yeah.
and to thrive.
Yeah.
So So yeah, we decided, you know, after having done a lot of these talks, one of the things that became apparent was that it, you know, first of all, we're unable to go through the full range and breadth of information that we would like to see covered, and you can't cover it all in an hour and a half or even 2 hours. I mean, there's several elements or several layers to what it is that we're facing. So what we decided to do was, and quite frankly, it was, you know, it was after listening to a number of Lane talks and stuff that we sat down and said, okay, let's put this all in written form so that people could really understand and wrap their head around it. Because we realized that after every discussion, people just felt overwhelmed with a massive amount of information that they were given.
Yeah.
And because it's given to you orally, you know, verbally, and if you know, it's good to be able to have sort of a written source that you can go back to and refer to at your leisure, to be able to wrap your head around all of it. So that was the motivation behind the book. It's an ebook. It's easy to read, and one of the things that I love about Lane is that he makes the science accessible. We think that if you respect people, make the science accessible, tell them what it is that they need to know, treat them like freaking adults, you know, frankly. You know, people can make decisions based on their situation, what it is that they have or resources that they may have or don't have, you know, and can make better choices. I think one of the things that gets in the way of people following any kind of even if you look at what like the New Zealand minister did, they didn't just say no, everybody got to wear masks and everybody got to social distance and everybody got to. What they did was they took time to explain things to people, and we have not heard that from the head administrators on down. In fact, because people are starting in an information chasm, they started with this is a hoax. This is not real. It's going to be over with in a few months. So you're starting at an extreme disinformation. So we have to debunk a whole lot of information before we can start educating people to the real facts so that they can even begin to understand what this is about and then make some good decisions. And unfortunately, we're doing this right at the point when it's crunch time now. And if we had started this back in March and April and May, even June, people would have been way more prepared for, or could have been way more prepared for this moment.
Well, and I think that's important because, you know, folks, we could talk about the physical part of the viral infection and pathophysiology, but now what's happening now we're into the part where it's almost equivalent to having a mental, rehabilitation, mental insult. Because one of the things you have to understand is that people are psychologically challenged now. People are complacent. People are pandemic psychosis. People are fatigued. So we started the information wrong. I didn't start the information wrong. I've been on the money from day one because I'm trained in this stuff. But wear a mask, don't wear a mask. It's a hoax. It's not a hoax. You got Fox people telling you to take this medication. You got the president, the ex-president talking about drink Clorox and bathe yourself in UV radiation. So this has killed so many people. So our responsibility, Dr. Jones and I, and you, Queenie, is to make sure that we set the information right. Because when you are dead and we put you in a body bag, it's over with. So our responsibility is to make sure that you don't get there. And plus, we can do this with great information, and also the fact that we can have a good time getting there if everybody's on the same page.
Yeah.
Correct.
Oh my goodness. I so, you know, appreciate you saying that. I think that the reason why we took it serious far too late is because it was presented to us as if it wasn't real anyway.
Correct.
It wasn't that big of a deal. And I think just naturally we responded, and I say we as a people, I think we just naturally responded like, oh, well, maybe it's not, or it doesn't look like they're, you know, that anything's wrong with them, or, you know, they're not doing anything about it. So, you know, I mean, all kind of conspiracy theories started to arise. I mean, it was a lot. And I think people started to believe more of they started to believe the doubt more than opening up for the truth. And the truth was, unfortunately, just not making it to us without too many distractions.
Correct.
And so what I'm hoping is that going forward, I mean, so many people we know they have lost their lives, but I'm hoping that those of us that are listening are still here fighting this fight, that we do take it serious and we're able to influence others to take it serious. And I always say, if you're wrong, so what? Like if you're actually wrong, that, oh, this is not that big of a deal. Who are you hurting by, using precaution and by making sure that your loved ones are safe and your neighbors are safe and things like that, and you're not the cause of them becoming sick? There's nothing wrong with that.
Well, when you think about that, you're absolutely right. And the problem is that you have these people out here, pitching a certain false narrative. And when you look at it, I'm going to use people for example. We're going to use a Sturgis motorcycle rally in South and North Dakota. This thing has probably affected, millions of people. 200,000 motorcycle guys in the state of North Dakota. These folks are talking about their constitutional rights, and they affected people. They became the super spreader of the United States. Moms are died, fathers are died, and now they don't have any excuses and stuff. This is the stupidity of people when you're dealing with stuff that is not in their lane. And they took a different approach, and so now it's a consequences. And so the Sturgis motorcycle rally in North Dakota, South Dakota is going to be a human stain on the United States for the next 50 years.
Wow, that is
right.
That's
right. Because there were like several 100,000 people that went to the Sturgis motorcycle rally, and they're already talking about how it was a super spreader into the state of Minnesota completely. And I can't even imagine at this point what was the impact nationwide in terms of the amount of infections that one event caused across the nation.
The number's almost 1 million. They've kind of done it. These 250,000, I'm gonna call them fools, have affected 1 million people, and you can start doing the math on what the sequela, the morbidity, and what's going to happen on that. So this is why it's important that one of the things that when we got involved in this stuff, and and the position I am, is to understand that we can mitigate and contain the disease itself. We can contain the virus, but you have to have a plan from A to Z. You cannot have one component missing. Understanding biosafety, biosecurity protocols, understanding the pathophysiology of the virus, understanding there's a psychology or psychological component to it. If you do that with good education and basic treatment, we're going to be fine. But if you put your head in the sand, you're going to have significant problems still.
Wow.
Right.
Wow. So I want to make sure that we are incorporating the questions and comments that we're getting as they're coming in.
Okay.
We're all anxious. We're all kind of wondering what's going on. Amiko Parchment, I just want to show this. She said, thank you for making the ebook affordable for everyone. So let's talk about the ebook for a moment, because I know there is a collaboration going on, and I showed some of the information earlier. Dr. Jones, Blessing, and Dr. Rowland, you guys are doing an ebook. So I did put where we can find it, but what can the reader expect to receive once they pick this ebook up?
Dr. Jones, you go for it. You do it, Dr. Jones. Go for it.
Okay. Well, we actually have 2 ebooks out. One is called Navigating a New World, and that one basically covers the science. It covers sort of the basic. It's a primer on what is COVID, how a virus is spread, the 7 F's and the R. It covers personal prep, so things like getting an oximeter, thermometer, vaccine, mask, et cetera, et cetera, et cetera. It also there's a chapter on prepping your home. There's a section on radical self-care plan, a section on a mental health plan, seeking care, and then a bibliography for people who would like further information. So that one is sort of the primer.
Okay.
The other.
One more time.
I'm sorry, I didn't hear that. So the first one is sort of a primer. Can you tell me the name
of it once more?
Navigating a New World. Okay. And then the second one is called, don't let that curse word virus steal your holiday.
Hey, that didn't come from me. That's not my personality.
Yeah, right. That totally Dr. Rowland.
Yeah, I know it was him. I knew it. Okay. We can let him talk about that one then. You want to let him
Well, I'm gonna let him talk about that one in a minute. But let me tell you that the holiday book is really, now after you've read the primer, so to speak, the holiday book really gets into the practical applications of all the things that you learn in the primer. And one of the reasons what we found was that when I walked people through setting up a biosafety security protocols for their event, that's when they learned. Oh, I mean, that's when they had the aha moment about, okay, that's why you ask people to use the long lasting hand sanitizer. Oh, that's why you ask, so it makes sense in terms of, for people to really understand, okay, why once you understand the science, then you understand how to apply it. And it was actually taking people through a scenario. So that's what the holiday book actually does. Okay, take it away, Roland.
No, Doc. This is to defeat and contain and mitigate this SARS-CoV virus is going to take every one of us as a family. And so, if you have to explain something, explain it. But the bottom line at the end of the day is that, folks, you can talk about information all day long, but when you put it on paper, it really becomes alive, and it becomes a reference so people can say, wow, these are the 7 F's. Okay, I read this, though. Now I kind of understand, why I need to have an antiseptic hand washes versus an antibacterial hand soap that doesn't kill viruses and stuff. So this is a reality. What we have to do, we have to put this information in every home. Every person should have this ebook in their hand. This is your guide, how to get on an airplane, how to have a great Thanksgiving. Because I can tell you guys right now, I'm going to Maryland tonight. When I come back Wednesday night, I'm gonna have me some cornbread stuffing. I'm eating turkey, cranberry, potato salad. I might gain 300 pounds in one day.
All right. Okay. So we have the ticker going. It has the names of the books. Of course, I do have the website as well, and it has been posted on my page. And for those that are interested in the website, I can always drop it into the comment box. But I think, if I'm not mistaken, I have it here. It's www.auset-isis.org. And
Correct.
this is where we can pick up both ebooks. And I think there's other information there as well. I was on the website earlier, so there's plenty of other information there as well. But that's where we want to get those ebooks at, correct?
Correct.
Right. And I want to ask, one last thing before, I want to make sure everybody understands that this information that we're giving you is not static, it's dynamic. It's going to change as the information technology catches up. If we need to change things, we will add it. And so people need to realize this is a living, breathing document.
Yeah.
Correct. And even as the stats change, as the med and the science change, we'll also be moving forward, because we've already started plans for the Christmas holiday book. So we're already in the planning phases for that one. Okay. But so I think in the beginning, the holiday book, we talk about why telling people not to get together is a problem. And I think we need to be honest about how people are feeling right now, in terms of if they've been away and isolating and not really seeing their family and friends and loved ones the way that they normally or typically do, trying to tell them to stay away from each other over a holiday, which is it's not going to happen. It's sort of like, okay, so I'm going to reveal the opening line of our book. Telling people not to get together for the holidays is like telling horny teenagers not to have sex. Good luck with that.
Yeah, and that's so true.
I'm glad you can bring that up, Dr. Jones-Blessing, because we actually have a question in the chat, and I think you can see that. And it Gina S. asked, what are tools to cope with not being able to socialize or travel or go out places. And I think that would be, during the holidays, that would be, post having, COVID. Like I know some people have questioned that have, contracted it, or even, just people like myself that's been okay not contracting it. I mean, how do we cope with that? And I know, Dr. Westman, you likely have some great advice.
Well, okay, well, first of all, I think, I can't speak to everybody's situation, but I think once you read through the book, you can assess what opportunities you might have available to you that maybe other people don't have. So, for example, um, now this kind of gets to the end of the book where I talk about the importance of making sure that nobody is alone over the holiday.
Yes,
So that
absolutely.
I'm paying special attention to my friends who live alone, or and for whatever reasons may not be. Like I could give you an example. I have a friend who has lost her arm, her left arm, and she lives alone, and she had not been invited to anybody's house for Thanksgiving in the family. Now, granted, there's a whole lot of other contingency reasons why that happened. Their parents have died. Their family is just going through the normal transition that occurs when the matriarch and the patriarch has passed away. There's really no central place or home that everybody gathers around. So as a family, they're still trying to struggle with that. But she's feeling something that she wasn't invited to anyone's home for Thanksgiving.
Wow.
So we know, and she lives by herself. So we talked about that actually this afternoon. I had mentioned her. I was checking in with her. I wanted to know what her Thanksgiving plans were, what she's planning on doing, and then we talked about, because in her home she actually has a backyard and a deck. And I said, okay, well, it's going to be 48 degrees in Chicago. Let's order you have a deck, you have a yard. You can invite people over for some one-on-one time on your deck. We're gonna get a little patio heater. We located one on Amazon, so that'll keep people warm. I have a really warm coat that I can wear like to minus 25. I'm gonna bring that in my blanket, and I'm gonna have some hot coffee that I'm gonna sip through a straw, and we're gonna sit on. I'm gonna come visit you for an hour. Why can't And you can invite people to come over for an hour, different one, and sit outside.
Right.
Nobody has to go into your house. We can all make it without having to go to the bathroom for an hour.
Right.
But I think that's and there may be, she has other friends who are like family. I could call them family. Your chosen family. Invite them over for the holiday. Just to have an hour conversation on your deck. Because those are the kinds of things you can do. Looking at your resources and what are the things you can do. Oh, looking at individual resources and looking at what it is that can be done so that people are not alone. It is the other thing that I also invited her to is that we get ready to play the game. Revoke your black card.
Yeah.
We're gonna do that on Zoom. So she's been invited to the Zoom revoke your black card game. So there's but it's important to pay attention to the people who live alone and who may be by themselves on Thanksgiving Day, because that's horribly depressing to be by yourself on a holiday.
Sure.
Yeah. I so agree with you. And having an alternate way to celebrate each other and celebrate with
Correct.
each other, and being able to do it outside is wonderful.
You
Um,
know,
I'll share. And Dr. Lane, I think you might have saw that yesterday. I celebrated my girlfriend's 60th birthday, and
Oh yeah, I saw that
this
street
year
party,
and
boy.
outside. Yeah, the street
Yeah,
party.
big party. There you
DJ
go.
the DJ came. He set up on the sidewalk, and then we took the party down to the local restaurant. But we were outside instead of
Right.
inside. I initially reserved it for 8 people, and then when I walked in, I felt a little uncomfortable, and I said, "Well, it's still nice out. Can we just have the outside by the fire pit?" And we did. We had like 3 tables, and they were separate. And
Yes.
I mean, I tend to gravitate to my typical tribe, like my daughter is here. And then everyone else, I just kind of talk from afar, and
Right.
and it's still allowed it still allowed for that socialization, and I didn't feel as isolated. I mean, as a, I mean, I'm an empty nester, so
Mhm.
yeah, you kind of feel isolated, especially when you can't just have people in and out anymore. So,
Right, right.
but Dr. Rowland, talk to us. Tell us what we need to know in this book. What we need to know about navigating this time during the holidays. I mean, what are you suggesting?
Well, I mean, it goes back to again, I've talked about it 1,000 times. And I think what people need to understand is they need to understand what this virus is. I mean, how can you function in a world if you don't understand what you're dealing with? And like I've said before, this is the RNA virus, very infectious, has a lot of mutagenic capabilities. The virus has the ability to affect every cell in your body from your eyes down to your coronary arteries. We find the virus in your testicles. The virus can go transplant, or what we call transplacental plant for transfer to the fetus and stuff. So the virus itself and the virus is mutating. Now, what I think probably the newest information that people need to understand is that this virus is going from a bat into a human being. The virus has now jumped from us into an animal called a mink, and the virus has jumped from the mink back into us. So we have a new SARS-CoV mink virus mutation out there. And so all these mutations and understanding biochemistry is going to have a long-term and short-term effect on what the end game is going to be with the vaccination, possible treatment, outcome, and how severe this disease is going to be.
Wow.
Oh, right. Wait, what did you a mink? And when did this happen? Like the last time I saw you?
Right. Let me explain it again. This SARS-CoV virus is one of 7 human coronavirus of the coronavirus family. Well, guess what, folks? The SARS-CoV virus number 2 is a beta coronavirus. It jumped from a bat. We can look at the phylogenetics. The virus came from a bat, jumped into a human being in China, went around the world, and now the virus has jumped into another animal called a mink, which is a little furry, look like I guess a squirrel that they take the fur from. Right. I didn't know it was that huge in Europe and here in the United States. Well, guess what happens? The person at the farm coughed, the virus went into the mink, and the virus spread through all the minks, and the virus changed the SARS-CoV virus in these animals, and the virus jumped back into the human being and killed some folks in Amsterdam, made people sick, so they had to go and kill 15 million minks. And we have mink farms here, so now we have not just a SARS-CoV virus 19, we also have a SARS-CoV mutation mink. And this is the problem when you start dealing with this type of viruses. All the years I worked in the jungles of Peru, dealing with orboviruses like dengue, and everybody kept talking about there's going to be a vaccination. There's still no vaccination today, because when you start talking about vaccinations, you have to understand that these viruses that are very lethal to human beings are RNA viruses. For the audience out there, there's 2 types of viruses. You have DNA and RNA, the genetic material. When it comes to RNA, which is actually the message itself, these viruses are already loaded up. They have lots of mutations in them, and they're able to affect people. Right. And the only thing I would say, part of the book itself is to take this information, get it into a context that people can understand. And so, for example, if folks out there truly, really wanted to get through this whole endemic infection now, they need to understand how diseases are transmitted, viruses. So I always talk about the 7 F's. I always talk about the R. So you can open the book up, the first page, how are viruses transmitted? R, respiratory. What are the 7 F's? You have face, you have feces, fingers, flies, foot, formite, and food. And so when you understand that you can be affected by these what we call these principles, and you put these principles in your life, and you understand that, hey man, you know what? The virus can live on a cell phone for 28 days. Man, that virus can live on my clothes. The virus can live under my shoes. Man, this virus doesn't recognize 3 feet, 6 feet, 9 feet. That's why I have to have a mask, period, because the respiratory is one component. I need to understand that, man, this virus can live in feces for 35 days. So I can have somebody symptomatic, asymptomatic, come to my house, go to the airport, flush that toilet. That virus becomes ultra aerolized. 0.1 micrometers, what we say 70 to 120 nanometers in diameter. That's very small, and that virus goes everywhere. So these are the basic principles that people have to understand and have a fireside with a glass of eggnog with their family and says, hey, let's go over the book and go
Right.
over these and make sure that we understand it and write the notes down so everybody's protected.
Wow.
Right.
Okay, so I want to just talk to the viewers and the listeners tonight because you just went over a lot, and you've come to the Bar Talks podcast. This is your third time. You have left this information each time you stop by. You've talked to us about how it's transmitted. You've talked to us about taking those shoes off at the door. You have talked to us about the mask. You've talked to us about the distance. You've talked to us about, just being super careful when we're traveling. I hope that everyone is listening again tonight. I mean, really taking this thing serious and taking it in, because no one is talking about there being COVID, it going into a mink, and then now we got to kill the minks, and then it's back to nobody's talking about that, right?
Right.
So this is how serious. So of everything you've said, that really got me, because now I'm like, what in the world? But this is how misinformed we are and underinformed,
Underinformed.
right? So I really appreciate you going into that. And I know you I hear you, I watch you, you're talking, you're sharing, and I know it's redundant. You're just saying the same thing over and over again. And it's because I know you're trying to beat it into our head so we get it. And it probably can be sometimes overwhelming and exhausting, but I so appreciate you still saying the same things, telling it to us like we're kids, and hoping that we get it, because sometimes we act very careless and irresponsible like kids. And even though you both are constantly dropping this knowledge, sometimes we're missing it. But when I hear you break that down the way you just did, I have to pause. I'm over here like sharing and like, I need y'all to share this. This is what I'm telling everyone that I'm doing this to. So for those of you that are still on live, please just share it on your page. You can take it down as soon as this is over, but share it, because if you can just get the information out to one person, think about how many lives you can impact.
Right.
And our most vulnerable population. It's sometimes I hate saying most vulnerable, Doc, because we're all kind of vulnerable, and
Correct.
sometimes I oftentimes think about the elderly and those that are really really in poor health, and they know it. But in truth, I mean, I've been hearing of people that are in good health, and they're now either they have succumbed to it, or now their lives are totally changed. They're nowhere near as healthy and fit as they were because of the damage that the disease or the damage that the virus did to them. So please,
That goes back to what we talked about, what we talk about viral load. So you got
yeah,
somebody 18 years old that thinks they're Superman and they don't have to wear a mask, and they go to Walmart or whatever, and they go in and they breathe all these viruses in their lungs. It's like somebody coughing in your lungs with a viral load. You're not going to make it. I don't care if you're 2 years old, 10 years old, 100 years old. And so you're absolutely right. But for me, I'm having fun. I'm
yeah,
loving this
yeah,
because all the years I spent in the jungles, doing surgeries on 3-day-year-old babies with congenital defects, and hiking through the jungles and being bit by mosquitoes and taking care of snake bite patients and doing real epidemic clinics. This is fun for me. This is just
yeah.
education. I don't have to, worry about, contracting or getting bit by some, anaconda or a piranha. So this is fun, and I get to drink my eggnog
You
without
do get to
any.
drink.
Yeah. So
Right.
I'm cool.
Right. So I just want to jump in there for a minute, because it's not that, the thing about when you present something to somebody verbally, you do have to repeat it more than once. You have to
Yeah.
repeat it at least 3 times for them to really get it. And so
Mhm.
part of the reason for writing the book was so that people could have multiple ways of taking in the information, and also to review it on their own more than once. Because and also we don't, even in our discussions, I mean, we rarely get past the 7 F's and the R, and maybe some of the personal prep just in a conversation like this one. But I don't think we've ever gone into real deep detail into prepping your home,
No.
what your self-care plan should look like, mental health issues, and
Hmm.
how the pandemic will impact that. I don't think that we've ever addressed like what happens when you seek care. So those are and being able to give people, if they want further information, we have a curated bibliography short reading list that can quickly get you up to speed. If people just read the first two articles we have listed, the National Geographic articles that are listed in our book, you'll have a much better sense of what this is all about. Just doing that. So I think that the ebook gives people a way to be able to wrap their heads around all of the basic cognitive knowledge that they need to have. And then going forward, if they stay on our website and in our forums, they'll get the updates as we go forward. But I think the Navigating a New World gives you the sort of the foundation. The holiday book is going to talk about how do you apply these concepts in your life, in your lived situation. So, I think that's the value of the book, and that's the value of to the value add to the audience. And yes, we wanted to make sure that the book was affordable. That's why they're only $10. We know textbooks can be more than that, although this is not dense and it's not as big as a textbook, so to speak, because we wanted to make it readable and something that people would not be afraid to open up. And also for somebody that's a high school student, college student, maybe even an older middle schooler would be able to read this and partake of the information and understand it.
Okay.
And so that was the goal.
Yeah, well, I definitely appreciate that consideration. But I want to go back to our chat really quick. Dr. Rowland, Dr. Ben Carson was very sick with COVID. He swears by Olander 4X. What's this drug?
Oh, he got the same experimental drug that Trump got, which is a monoclonal antibodies that is supposed to neutralize the virus or blocks the virus from attaching to the individual cells and stuff. But I have to see the science. Whatever that's coming out of these guys' mouth, I don't believe. I'm just like everybody else. I'm very skeptic until I actually see the science and stuff like that. And that's just the reality. Is it a possibility? Yeah, is it a possibility? But I have to see the science, and everything I base my decision off is based off of science and medicine to be 100% accurate, because in this business, you can't be wrong.
Right. So let me ask you, Dr. Rowland, like I'm reading about this drug and I've never heard of it. I mean, is that something that would be available to regular citizens, or is this like special?
No. This is for special people, folks. And that's why it's very important for everybody needs to understand the way you're going to survive this is that you're going to have to be your own best protector. You're going to have to be able to protect your circle, your family, friends, and that's just information. And you're going to have to figure out what's the best treatment for you, if there is a treatment. Is the vaccine, is it worth it for you? Are you going to wait to see what happens? Or are you going to jump in line? And my point is that vaccines have saved humanity. It's made us what we are. Measles, mumps, diphtheria, polio, all these different elements were eliminated because of medications given through an injection or through a pill, what we call chemotherapeutics. But in this particular case, you got a virus that's jumped from a bat into a human into a meat back into us. A lot of mutagenic capabilities, 12,000 mutations within a year, 7,000 mutations in the spike protein. In my mind, we still have a long shot. So I have to be convinced after I've seen all the science.
Yeah.
Right.
I guess I wouldn't be able to get that medicine because I'm not special. But Dr. Rowland and Dr. Blessman, I want to just say again, thank you so much for the ebook. And Dr. Blessman, I know that you talked, kind of brushed over the mental health impact that this pandemic and endemic and the disease as a whole is having, right? The virus as a whole is having on people. What have you seen in your practice as is coming up that we're dealing with the most? Like, what is the common thread that you see many of us dealing with the most, and how are you advising us to handle and to manage and to cope in a time like this?
Okay. Well, first of all, there's very little information about how people, that I could rely on from previous pandemics about the psychological, how it impacted people psychologically. So that research is very limited, and that the resources are limited. But what I am seeing, though, first of all, we are all experiencing a catastrophic natural event. So, from that sense, we are all globally are experiencing this. And so we're looking at increases in anxiety, increases in depression. Some of it is fueled by concerns about finances. So we see more and more people who are going into poverty, not being able to pay bills, and with the relief packages not being voted in by our government, that certainly is going to have, particularly as we go into the holidays, that's going to have an impact on people. So you see an increase in anxiety, depression. There's an increase in suicides, an increase in, and some of this is fueled not only just from the pandemic standpoint, because of the social isolation, or the social distancing, people are not necessarily having the same emotional supports that they typically would have.
Yeah.
Whether it's, being able to go to the bar and, hang out with the girls and have your usual Friday night, I'm hanging with my girls, I'm chilling with my girls, or whatever it is that we used to do, socially, or or even like our book club, we have to do it on Zoom now. But but even with the adjustments, there's a lot of it doesn't take the place of the in-person. Also, one of the things that's, first of all, we're all social people, and we are also accustomed to having, or it's important for people to have a certain amount of touch. Meaning, scientifically, we all do better with 20 minutes of touch every day, somehow. Whether it's a hug, whether it's something you're holding hands, whether you just snuggling up next to your boo, whatever. But having 20 minutes worth of touch time is important. It's important for our psychology. So in that sense, we are all experiencing this psychological stressor. And
let me ask something. Let me ask something. I think the word for everybody and everybody on the planet, everybody has post-traumatic syndrome from this.
Correct.
I think it's also important. We talk
Not
about
post,
the effect.
It's ongoing.
We're talking, yeah. What I'm talking about is the effects that has on children, and that's one of the biggest things I'm concerned about in trying to get society back open, trying to get people to be able to function in this new norm. People to go to school, McDonald's, et cetera, because you have kids in certain states that rely on the school system to be fed. So that's very important. You have kids that are in homes that are being sexually abused, or women that are going through domestic violence and stuff, and so our responsibility is to get people back into some type of new normal. But these are some of the other psychological or defects that people are going through this traumatic syndrome.
Yeah.
Correct. And then on top of that, if you came into this pandemic already with a mental illness, because there are people who depression is very common. So if there were people who probably came into the pandemic with, probably with a previous history of mental illness or currently. So we're seeing that more and more of those folks, do we see a worsening of those conditions? In large part because a lot of their social support, because you can't go see your therapist. You can't go see your therapist in person anymore.
Wow.
And not everybody has access to a way to do telehealth or teletherapy with their provider. Also, teletherapy is not as, unless you know the person really well, it's hard to start. Unless you know the person very well, it's hard to really sense what's going on with them. So like with some of my clients that I knew before the pandemic, I could probably tell from just the way that they answer the phone, like really how they're doing. But for somebody that's brand new or somebody that I didn't know really well, there's a lot that I would not be able to pick up on. terms of
Get the
their
affect.
in terms of their behavioral cues, or
Right.
the way they breathe, or what does a certain gesture mean, or the things that there's so many things about a person that you get, the whole gestalt that you get about a person by being in that one-on-one, face-to-face context, that tells you a lot about what's going on with them. You may not see them tapping their foot, or all the little things that they can do that can give you information about what's going on with that person. That's nonverbal, the nonverbal cues.
Well, I can tell you folks right now that, as long as y'all follow me, we're gonna have a good time getting through this. Hold on, let me drink
Oh
my
yeah,
eggnog
right. So
because I'm gonna tell you right now, Dr. Rowland, I'm a leader. We got to
okay,
be positive. We got to move. I
so
ain't waiting around.
I'm not saying that drinking is a way to get yourself through
No,
this.
no, this is eggnog.
One of the many coping, yeah.
Okay, but okay. So for those who have a mental health illness or whatever, figure that out. But I'm just going to talk about in general, for the general population. What can we do to cope with this? First of all, I think it's okay. Be okay with telling your people and your friends, "I'm not okay today."
Absolutely. Yes. Yes.
Okay,
So
you
huge.
know,
And I
right?
don't mean to interject, but Dr. Blessman, that is huge, and it's even more huge for us as African American Black
Women,
women and men as well.
right?
Admit that we're not okay. We
Hmm.
gotta have a safe space to say, you know what, I'm having trouble with this today. I'm not
Right.
okay today, and it be
Now,
okay to
you'd
say.
be okay.
Go ahead, doctor. You can
Yeah.
finish.
So
That
that
resonated with me.
well, and that's important because I think that like you mentioned, as Black women, Black men, people assume that we just gonna shoulder through this, and and there are days when there are days when it's like, what, I'm tired of my husband, I'm tired of my child, I'm tired of their whining, I can't go, you know, I'm through.
Great.
I'm ready to get on the plane and leave all of y'all. Let me go somewhere else. Okay. Y'all not getting this.
Yeah.
So first of all, just being okay, that it's okay. And the other thing that I'll probably post this in our forum on our website. When we ask the question, "How are you?" That's such a typical question that we ask everybody when we greet them. "Oh, how you doing? How are you?" And I'm suggesting to people that you take that a little bit further, that you don't just stick with the pat response, or the oh, I'm doing fine.
Yeah.
No, how are did you get some sunshine today? Did you connect with people today?
Yeah.
How are you drinking water today? Did you take your medications? If a person takes medication, or your supplements? And I have a whole list of questions that you can ask your family and friends and loved ones, your beloved community, to really check in with them when you ask that question, "How are you?"
Right.
To not let it be a superficial question anymore. We have to really, it's going to be important to really check in with people and see how are they doing.
I love that. Dr. Rowland, how are you?
Well, I'm doing super fantastic. How you guys doing? You
Okay.
guys, you know how a Southern gentleman. You guys know I'm from this great state of Louisiana, and us Southern gentlemen, we just seem to be just laid back, and I like being laid back on a Sunday.
Dude, that's right. Because normally we're here like on a Saturday or Thursday. I don't on a Sunday, but I'm glad to know that you're doing well. So, Dr. Rowling, you're still rolling around. You're
Yes.
still rolling around the U.S. So, share with us how you're staying safe, how you're remaining safe, because you're traveling. Dr. Jones, Busman, I know you were like, you want to just get on a plane and go now. I don't know about you, but I haven't been on a plane yet. I just haven't been able to bring myself to do it. But I watched Dr. Rowland, and I'm
Right.
like,
Like we say, I understand. I understand situational awareness. I understand disease transmission, and I love flying. I'm flying in 4 hours again. Flew yesterday from Atlanta. Now I'm going to go to Salt Lake City, then Salt Lake City to Maryland, and probably to Atlanta or Mississippi. But I understand the environment. I make sure I wear my mask. I make sure I wash my hands. I make sure I don't try to use the bathroom in the airport. If I'm touching any things, I'm definitely desanitizing my hand. I'm not taking my hand and put it in my face and stuff. When I get out the airport and I'm back to the regular society, I continue to practice good biosafety protocols for myself. And that's how I'm going to make it and stuff. And that's how everybody has to look at it, because you have to look at everybody as a potential affected individual. That person you think you look at that it looks normal might be the biggest super spreader in history. So if you do this stuff, you're going to be fine. Wearing your mask, folks, is not an option. It's mandatory. Wash your hands. It's mandatory. Making sure when you get into a hotel room that you don't wear your shoes in your room. As mandatory policies and procedures. Make sure you have a mandatory biosecurity protocols that you can do a mental check off in your head to protect yourself. You do that, you're going to be fine. And that's just the way it is and stuff.
Right. So when we,
okay, I'm sorry. Go ahead, John.
When we, on our forum, we can certainly go into like a listing of things to do when you go into the airlines. I've written, based on what Dr. Rowland does, I've written out biosafety travel protocols for how to get on the airplane.
Hey, don't forget about the glasses.
Oh yeah, the eye protection, what you need to take with you. But the other thing is, because I see pictures of Dr. Rowland on the plane, and I never see anybody in the row behind him, in front of him, or beside him. So first of all, I don't know what class he's flying, but he makes sure there's nobody sitting next to him. Okay?
Yes, let's talk about that. What class are you flying, first of all? Because
that is classified. that is classified.
Okay, so my girlfriend, who's an airline stewardess for Delta, she's wearing, I work with her, and they supply them with eye goggles and N95 level masks. She, I tell my friends when they fly, she's not able to cover her hair, but I tell people to cover their hair. That whatever you're wearing, that it needs to be something that you're wearing on the plane. It needs to be something that you can immediately take off when you get to your destination point, and either spray it down with Proguardium or wash it. You have to take Proguardium and alcohol wipes with you on the plane, because you need to sanitize your seat belt, your armrest, the tray tables, anything that you use. Sometimes you need alcohol wipes if you need to quickly sanitize something, because sometimes, for us women, we may not necessarily be able to hold it. So we might have to go to the bathroom. So you use the alcohol wipes to open up the stall door, to wipe off anything that your skin or any of your belongings may touch.
And make sure
alcohol wipes with
and one of the principle of that protocol that Dr. Jones told everybody, make sure that you're sterilizing that ATM card.
Yes.
150%, because that is probably the number one source of infections in airports.
Correct. And the touchpad that you use to, if you have
make sure
you do that. Right. Yeah. So anything that you touch, you have to be sure that you're sanitizing that before you touch it. And we also suggest that people use a long-acting hand sanitizer once period. I think Safer Palms is 12, 24 hours, whatever, but it's a good one. Hand washing, we talked about, I think Dr. Rowland may have talked about that before. The CDC will tell you that you don't, wash your hands with soap and water. Well, soap and water doesn't kill. I learned this from Dr. Rowland. Soap and water doesn't kill the virus. It just dilutes it. So it's important to use an antimicrobial, antiseptic soap. Wash your hands the way doctors wash their hands. There's a product called Safer Hands that has chlorhexidine in it, which is the same solution that doctors use that's in their surgical scrub. So that provides 24 hours of protection. You wash your hands with that and then use hand sanitizer over that.
And you're good.
And you're good. So that takes care of your hands.
Okay. So let me pause you for a moment. I have a couple questions. One of the questions is from Kevin Noble. He asked, do the UV wands work?
UV1 radiation?
It just says UV ones. Maybe
Well,
there's
there's three types of there's three types of UV radiation. There's UVA, there's UVB, and UVC. I'm very subject to UVA and B because I really don't know if it really works. For you to absolutely have 100% cure, you can use UVC, but guess what? When you use UVC, you can't have plants in the room. It'll kill you. That's how powerful it is. So that's something that you have to be very, very trained in using that type of radiation. And so the other radiation, the UV1, C, B, whatever the case is, I haven't seen any scientific medical papers that said that it actually kills the SARS-CoV virus.
okay.
Maybe coronavirus, but it hasn't killed the actual SARS-CoV virus that's causing this global endemic infection now.
Moment, since you broke that down, Dr. Rowland, SARS-CoV virus and SARS-CoV virus and the coronavirus are two different viruses.
Let me explain it very carefully for everybody. There are out of the 400 coronaviruses that bats have, there are 7 of them that affect man. There are 4 of them in a family called the alpha coronavirus, and there's 3 of them in the beta coronavirus. Well, in the alpha coronavirus, you have 229E, you have HL63, NK number 1, OC43. These 4 are the common cold. We've all had this. I mean, I've had it. You've had it. Everybody on the planet has had this particular coronavirus because it's the second to third leading cause of the common cold. Now, the family of the alpha coronavirus, the cousin is the beta coronavirus, and that you have 3 that are lethal, pandemic, epidemic. That's SARS-CoV number 1 from 2002 year. You have Middle Eastern Respiratory Syndrome from 2012. And then you have what we call the SARS-CoV number 2, 2019, 2020. Well, these 3 are the lethal human pathogens, game changing. And so when you look at bottles, it says, well, this Lysol kills coronavirus. It's not killing SARS-CoV virus. If this bottle says it kills coronavirus Clorox, it's not killing the SARS-CoV virus. So people need to make sure they have that big distinction because that can be the difference in you being sick and dying on the technology that you use.
Wow.
Correct. Correct.
That's huge. That's huge. So again, I hope that the viewers and listeners heard that.
Okay. But on the other hand,
Sure.
there is a HVAC central air filter system that you can put in if you own your home. There's a central air system, that air purifying system that uses UVC light to kill virus, and in that context, it's appropriate and it works.
Okay.
So that's what I mean about, sometimes some things are not just a simple yes or no.
Right.
It's, okay?
Right. Okay.
So like I just purchased one for my house in Shaker Heights. I just, for my tenants, I just purchased the air purifier for them.
Okay.
That has the UVC light and it's proven effective against COVID, to kill COVID. And, and so that's an upgrade to my home.
Okay.
So if you can do that, that would be good. But those wand things, I wouldn't use it. I have a 12-year-old child. I wouldn't trust that around him because he'll play around too much with it, and it's dangerous.
Yeah. All right. So Dr. Rowland, I want to bring this up, and then we'll go into another question or statement. Saferhands.us and Uncle Kutsky. Come on, talk to me about Uncle Kutsky.
well, I don't know, probably back in April on one of them southern nights, and I could hear the thunderstorms.
Oh boy!
At 4 o'clock in the morning, I was laying around hearing the cicadas talk, and I started thinking about children. And I said, you know what? It's amazing that we got all this information, but nobody's talking about children. They were talking about children with Superman. They weren't they couldn't be affected by the virus, but I knew otherwise because I've seen children affected by diseases in the world. And I said, we have to start talking to children, teaching children how to wash their hands. So I was sitting there at 4 o'clock in the morning when a big thunderstorm hit me, and I came up with Uncle Kuski. He's a mosquito. He's a dapper. Looks like a crazy uncle with his flat top hat, white gloves, cane, and his responsibility is to teach kids how to wash their hands. And so that's how he became, and he's a real character teaching kids how to wash their hands. And Dr. Jones has helped develop him with some of the lingo on what he needed to say so kids can understand that lingo. But Uncle Kuski is changing the way the world is. He's more popular than Mickey Mouse because Mickey Mouse is quarantined, Uncle Kuski working.
Okay, absolutely.
Love it. So parents can find out more about this Uncle Kuski, because I said it wrong, at www.saferhands.us, correct?
Yes.
All right.
And
So,
as a parent, I have a 12-year-old, and
yeah.
As a parent, I really didn't want to have to worry so much about all the things that his hand touched as he left our house, because we counted it up one day. How many things does he have to touch to leave our condo and get outside? So he touches 5 things. I know he's not going to sanitize his hand every time he touches something that somebody else touched. So between the Uncle Kotskis and the Safer Palms hand sanitizer, we're good. you know. So as long as he re-ups every 4 to 6 hours, he's good. His hands are going to be okay.
Okay.
Yeah.
Okay. All right. So we're going to move back into the chat real quick. It's always great to talk to you all, but look how the time just flies.
Yeah, I got a plane to catch.
I know. So we're about to wrap this up because I know you on your way to my area. So
if I'm there tomorrow, I got the meeting with NIH in the morning. If I get time in the afternoon and I get to fly, on Tuesday, if I come to Baltimore, I'm definitely gonna get me some crab cakes.
I know that.
Always got to get crab cakes.
And if you get some, send some to me because I love Maryland crab cakes.
If I fly to Chicago on my way back, I'll stop for sure and drop them off.
So, Dr. Blessman, really quick, one of our viewers made a point. She said that teletherapy may not be safe for some people in abusive situations. I worked in DV for quite some time, and I know we advised some of our residents that they could, some of our residents that they could, they could actually talk outside or any time that abusive partner wasn't present. Just set the appointment up then. But I do know that sometimes it's difficult to get an appointment during that time. So what would you suggest? I mean, how will a person navigate that?
That's a challenging one because privacy is key, and you don't have that kind of privacy if you're doing telehealth either in your home or in your space. Right. So it would be important for the person who's in the abusive relationship to be able to find whether they went to I guess, if things shut down, they won't even be able to go to the local coffee shop and have that conversation. It's going to be challenging. At some point, it's going to be challenging, and I can't. There's no pat answer to that.
Right.
It depends on what the resources are, what that person's resources are. If they have a friend who has a backyard deck, I mean, they might. You have to get inventive and to figure out ways that they can have that conversation in privacy, because I think that's going to be key.
Right.
And then that's everybody's situation is going to be different. So there's no pat answer to that other than find what privacy can you get to have a conversation. And it's going to create a strain. I mean, there's nothing like a situation like this to make it really clear that maybe it's time to go. Or you don't have to make a change.
Thank God for DV programs. So, I will also add that with my therapist, again, it depends on the relationship that you have with your therapist. My therapist, she's really cool and laid back, right? She's somewhere probably hugging a tree right now. She's just cool like that. And because I communicate with her through an app, I can always send her a message and ask her, say, hey, I can't get an appointment with you for another 2 months, but do you have any availability that you could kind of slide me in? And I think that a person that may be in an abusive relationship, if they have a relationship already with that therapist, sharing with the therapist what they're going through, that therapist may actually create some safer space and flexibility for that particular client to be able to reach out to them at whatever the convenient time would be for the client. I can't speak for all. I just know that my therapist is really cool. And I mean, So
So, and there have been some in some cities. I know in Chicago, I can't speak for every city. There are, because they know that COVID is presenting a very unusual challenge for people who are experiencing personal violence, domestic violence. They are offering enhanced services and more services, hotlines, and more shelter services for people who are experiencing domestic violence. So you'd have to research, look in your area, what's available in your area now,
right.
given COVID. So, yeah.
All right. So Dr. Rowland, I got 2 questions for you, and then I'm going to let you get out of here.
Thank you. Appreciate it. Let's go.
All right. Should we be concerned about our clothing after we have, or maybe there's another one, but after we have been out, and should we wash each item we buy before bringing into the house?
I don't think necessarily, washing each item, new clothing. I think you could spray it down with a mini bio decontamination unit with the hypochlorous proguanidine solution. And then if you're out and about all day long and she's spraying it now. But if you're out and about in public, in general, around lots of people, you go to church, you go to, Walgreens, Walmart, you're out there shopping, in the mall, you come back home, my recommendation would take them clothes off at the door and wash them. Don't bring them in the house and lay on your couch yourself, because it's like we say in our book and stuff, and I've defined that what a formite is. And formite is an inanimate object, and that could be your tennis shoes, could be your clothes, could be your hat, it could be your glasses. Exactly. And so that's very important. This is just good biosafety, biosecurity protocols, basic 101 to be able to function in that new norm. So it just makes you think a little bit better and stuff.
Yeah. Okay. Last question for you,
Okay.
Dr. Rowland. Is eating out safe? I have noticed a lot of people inside, cooks and cashiers, have their mask under their nose. Oh my God.
Well, there you go again. That goes, so again, that breaks the policies and procedure, because the virus can go through your nose. It can be breathed through your nose or transmitted through your nasopharyngeal, oropharyngeal area. So this is what we have to make sure that everybody has to have a timeout and be re-educated on the proper way of understanding how diseases are transmitted through the 7 F's and R, because that type of stuff gets people killed. So you can imagine that person, waiter, has his nose down, the mask down, and he's breathing on your credit card.
Yeah.
Right.
Wow.
Or your food, or your menu.
Or your food. Yeah.
Exactly.
Right.
Okay. So Dee Johnson said, thank you so much for saying that. She was talking about how we're talking about being strong Black women. And she says it feels like you have to be a superhero in a world filled with villains, even more so with this pandemic. And so, Dr. Blessman, I know that you addressed that already. I just wanted to make sure you heard the comment and the response. Dina also said, thank you for addressing and providing ideas and options as it relates to seeking the teletherapy and telehealth. I want to say to both of you, thank you so much. And I want to give Dr. Blessman, you and Dr. Rowland, your last words before we end this discussion tonight.
Well, only I want to say to all the folks out there, because I'm in a Southern hospitality mode right now on Sunday. I'm getting ready to stroll on down to the airport and catch a late night flight to the great state of Maryland. I look forward to seeing you folks next month in the part 4. And this one's going to be called Peppermint Schnapps, is what we're going to have, because it's going to be cold.
All right, so he's saying bring peppermint schnapps for the holiday.
For the holidays.
Yeah, so we actually will be coming on before Christmas.
Yes, peppermint schnapps.
Which is really good. We'll be coming on before Christmas, so that's really good. I have the srsproducts.com rolling in the ticker. That is where you can find the ProGuardium that Dr. Blessman is spraying. The ebook, we also have the information for the ebook. I'll put it up here one more time. I love the name that Dr. came up with the one for, I guess, Thanksgiving 2020 and COVID. Don't let the virus. Go ahead and say it, Dr. Rowland.
Like a Southern gentleman, I'm gonna be very, very light. It's like Mama said, the words are like out of a box of chocolate. You don't know what you're gonna get.
Thank you both for
Bye,
collaborating.
guys. I gotta go.
I know you gotta go. Bye. I'll send you the information. Bye,
Thank you.
Dr. Blessman. Oh my God, he is such a.
He's hilarious.
I love him dearly. Thank you
I,
so much tonight. You know, I cannot wait to download the ebook. I plan to send it out to my family. I share the information with them because this is it's near and dear to my heart.
absolutely.
And I'm still trying to figure out how to navigate it. I'm such an extrovert. And so I've been struggling with navigating this new normal. And so it's a lot of this, even though I'm giving it to the people, it's for me. And so I really appreciate you and Dr. Rowland taking the time to stop by here and to share each month with us and just keep us abreast of what's going on. And you know, and look, it doesn't cost us anything but time and the ability to sit down and receive the information. So I so appreciate you and I honor every time I get a chance to listen to you and all the information that you share. I honor that and I just love it. If there's anything else you want to leave for our viewers tonight, then please do so at this
Okay.
time.
Well, I just want to say that, first of all, we are going to survive this. We are fine. We are all right now. Take this moment to be thankful and grateful to the Creator for your health and blessings and whatever it is that you have right now. Thank you that we're able to at least impart this information to other people. Do buy the books and share it because, you know, our intent was that we want this information out there as widely as possible. And understand that, you know, with all experiences, good or bad, are blessings and there are lessons to be learned from them. And it's important to figure out what are the silver linings that come as a result of this experience that we're going through. This Thanksgiving can be reimagined in ways that perhaps we hadn't thought about before. And so we hope that the book will help spur you to think about perhaps doing this Thanksgiving somewhat differently and coming up with some different Thanksgiving traditions. And there's some links in there that would that will help you think about that. Some new things to do. So we wish everyone a good holiday. Make sure you look out for your friend who is living alone and make sure that they are not, that there's somebody that's reaching out to them during this holiday season to spend time with them, even if it's just an hour sitting on their deck, like I'm doing with my girlfriend.
Yeah.
You know, sipping some hot sangria or something. You know, we're gonna do something. But take care of the people who live alone, and particularly, you know, it could be the elderly person, it could be your girlfriend, it could be, you know, whoever it is that lives alone. Make sure that they're having some social connection and some human connection during this holiday season. You know.
Well, thank you.
And thank you for your lovely Queenie. I love it. I love your energy. I love that you're using this platform.
Oh, I love it. I always love when you stop by. Let's see. So everyone is saying thank you. Someone said, I love Dr. Rowland. He's the truth. Dr. Gordon team, Dr. Rowland. Great show, Dr. Blessman. You are the truth as well. Stay safe and God bless. It's so wonderful when people are sending us like well wishes. We're just out here trying to do our own, do this thing, for the people. And but it's good for people to send us good energy. So it's nice to see that in the chat box. But Dr. Blessman, thank you again, and I look forward to seeing you next month.
Okay.
Birthday month, so I'll be like,
okay.
I'm a Sagittarius, so I'll be all fiery on this screen next month.
Okay, all right.
And I will share with you that we have a new podcast platform. We just started a brand new platform. It's called the Relationship Zone, where we talk about real life and relationships and love. So I may need to bring you to the show to talk, and it may not have to be about COVID, but about love, life, and all things relationships.
I'm happily married, so
I can use that information. I can use some input. So our show, it's my first time announcing this publicly, so people are listening. But it'll be dropping on my birthday.
Okay.
Yeah, so it'll be dropping on December the 12th. And Bar Talks, the podcast, will be kind of phasing out. It'll start being I mean, we'll still use it a little bit, but we're gonna switch it over, and we're gonna be talking about love, life, and all things relationships. And so it's really nice to see this good energy coming in. Um,
Okay.
back to us. We're giving out, and it's coming back to us, right? So I love that. So again, Dr. Blessman, I'll see you next month. God, December is already here.
I know. It's
Isn't
almost here.
It's almost here.
Right.
So before you go, I ask you, what will you be doing? So Thanksgiving, you'll be spending some time with your friend.
Mhm.
And will you be
Actually,
cooking dinner
thanks,
for the family as well?
Thanksgiving Day, I'm actually spending time with my family. It's just the three of us, my husband and my son. So we have a Thanksgiving dinner plan. But actually, the day starts with we're going to do a 6 a.m. Thanksgiving walk.
Yes.
Where the three families are coming together. We've been walking every morning at 6 a.m. That's been part of my radical self-help plan. We
Yes.
walk for 3 miles. We're grabbing all of our other family. We can be socially distanced.
Yes.
And we're going to have our 3 mile walk on Thursday morning. And then we'll go back home. We'll go to our respective homes and cook dinner. And then after dinner, we plan on playing the card game, Black Card Revolt. And then I'm meeting my girlfriend for a quick, for an hour at some point to have our drink and, just spend some time with her. And then at the end of the evening, we have some friends in Tennessee, and we're going to do we're going to watch a movie together. I don't know. There's some kind of movie sharing platform, something or other, but we'll be, so it will be Zooming it, Zoom, in person, a little bit of, and then our family dinner, just the three of us. For our family dinner. And the walk is the big thing. Though.
Good. Yeah. So you have
A
things
full day
planned out. This is what I think, I hope many, others decide to do. I know that I'm planning to kind of do a few different things on Thanksgiving as well, to include rest. And definitely going to get outdoors and enjoy the weather. And I'll make a small meal as well. But I think it's really good. And of course, I'll Zoom and check in on people. And of course, my friends know they want to find me. They can find me outside and come hang with me out the door, and we can, have a good time. So I'm glad to know that you're going to be doing something amazing. And I think those that are listening, they'll take a page out of your book and be like, yeah, maybe we could do that as well. So again, Dr. Blessman, thank you so much for coming to
Thank you for having me.
viewers. Thank you for joining us again tonight, talking about COVID, trying to get this information out there. I just want us all to stay safe. And as Dr. Jones Blessman said, we're going to make it through this. We are. So let's continue. You saw the links go across. You can order the ebook. You can order the Progardium. There's so many things out there. Definitely check out the websites. Follow both of these amazing people on social media so you will not miss any information that they are sharing. Dr. Blessman, until next month, take care and have a wonderful and happy Thanksgiving, okay?
Yes.
Bye.
Bye.